Hello again. Well, here at EASD TV, we really like to focus on the things that are important to you. Everyday practice of diabetes. So to talk today about patient-centered care, we have on the line Evgenya Patrakeeva and Florian Toti. Welcome to you both. So Evgenya, introduce yourself if you would.
I'm a teaching assistant in St. Petersburg Medical University in the Department of Endocrinology, and my main field of interest is psychological aspects of diabetes care, patients' education, and technologies and diabetes. For last year, I'm working a lot in pregnancy and diabetes issues because in the country for now there is a huge room for improvement in this field. And for last years, I'm a member of postgraduate education committee of EASD, and we are having a lot of work in e-learning courses. And I hope for offline courses, which we have in future, like traditional EASD postgraduate courses for diabetologists.
Thank you. Florian.
Hi, I am Florian Toti. I am professor of endocrinology at the University of Medicine in Tirana, Albania, and chair of Diabetes Education Study Group. So, as the name of the group is suggesting, we are mostly interested in the education of people with diabetes and to increase the knowledge of healthcare providers, how to better educate people with diabetes, to raise the awareness and to raise the level of knowledge for people with diabetes about their disease and their related metabolic disorders.
Let's get down to this, because this is an area that's so important. Evgenya, patient-centered care, what do you mean by patient-centered care?
For me, the answer is easy, because, we need first, as healthcare professionals, we need to think first about patients and about their beliefs and hopes, and about not only about some numbers of glucose level or cholesterol level or blood pressure, whatever you want to discuss. But we need to think about patient first. So patient care is patient and his or her psychological issues and his or her family problems, maybe some social status. So as a healthcare professional, we need to try, at least to try to help for all the patients, not for just parts of the healthcare problems like glucose or something else.
So, Florian, patient-centered care is seeing them more than just a number or just their glucose level. What particular things do you think are important when, for instance, you first see a patient to establish and find out?
Normally I say that there are no two types of diabetes. There are as much type of diabetes as our patients are with diabetes. So everybody is special and everybody has something that is unique to him. So we need to tailor our education to special requests of the patient. So there are some common issues for people with diabetes, but there are, as Evgenia have already said, that there are some issues that are specific to each of our patients. So if we have a patient with type 1 diabetes, we need to focus more on insulin therapy, let's say. And for type 2 diabetes of young age, we need to focus more in health, healthy lifestyle. So this is just something big, but in more detailed way, we need to see our patient and to decide with him what is the most important for him too.
So, Evgenya, how do you start the conversation with patients? What are the first things you think you need to find out about the patient?
I mean, for all my colleagues which working with me, the work with patients started not from the consultation, even before, when the patient is waiting in the waiting room or corridor somewhere, because usually we try to ask them before. We have a short like tables and give all like 50 or something else, maybe a little bit more for the patient in the waiting room, and ask patients to choose 3 main important issues in diabetes care which patient needs to discuss in this consultation. And when the patient come to my office, they usually just give me these 3 options, and we started to discuss from the 3 main important things around this particular patient, because there are so many issues to discuss in diabetes care for every patient, like hours and hours of work. But of course, as a real practitioner, I don't have a lot of time for every patient, like hours. So the first thing which is maybe very useful to use for all professionals, it's to start the consultation before the consultation. And the second question,
so a pre-consultation consultation, something like a questionnaire, which of course actually focuses a patient's mind. And forgive me, I'm calling them patients, but it's really people living with diabetes, because lots of people with diabetes don't see themselves as patients.
Yeah, and it's a part of patient-centered care to call them not the patients but people with diabetes, because not for all of them, but for great part of them, it's just a way of life.
And actually, that language really matters, doesn't it? Because one of the things that's, and particularly this is with type 2, there is a stigma about type 2, and people think that they're being judged, or that they're being told that they're a failure if they're moving on to insulin, having been on medication before. So there's a very careful choice of language which is needed. Evgenya, would you like to talk about that a bit?
There is a stigmatization process not only about type 2 diabetes, it's about all types of diabetes. Because, for example, in my country, for type 1 diabetes, it's like if you have this disease, you are sick. So you need to think about insulin, all these things about insulin pumps and everything. You can use your body for physical activity as a usual person. So the question of stigmatization is a very huge problem everywhere, not only, I believe. So maybe the idea here about patient-centered care, it's the very careful usage of language, because language really matters. And the second question, which is very important, I think, in this conception, is how can I help you? Not just ask about blood glucose again, like diaries or something, pumps and sensor. Just ask the patient first, what I can do for you just now for next 30 minutes. And it's also a question about patient-centered care. I don't know, Florian, do you agree with me? I know that you agree, but just maybe...
So I can see all during this, while Evgenya was talking, Florian was nodding his head madly.
Yeah.
Florian...
Well, the language is different, but the problems of the patients and people with diabetes are almost the same everywhere. So, as Evgenya has said, we have another methodology using, at least me for myself. In some cases, there is the doctor phoning me or sending me a message before just what is the most important for this patient, sending to the consultation. And in some cases, I ask directly to the patient, what do you want to focus on this moment? So we need to prioritize and to put the patient first. So what is important for him? Because for the doctor could be something completely different from what the patient wants at that moment or from that consultation. And it's a question of creating a trust between the patient and, or people with diabetes, as you have already mentioned, and the doctor in our case. This is really what is the patient-centered education. So we need to find or to decide between us what is the most important for the patient, what does he want to discuss with us at the consultation.
And actually that also makes the patient, or helps them, feel in control, that the disease is not in control of them, they are in control of the disease, if they are having their particular concerns addressed. Evgenya, how do you go about ensure, well, you said you have the pre-consultation consultation, but then what are your next steps, and what particular issues come up again and again?
I mean, it's like practical point of view. Of course, all our consultations, they need to be added to a patient education course or something. But nowadays, it's a little bit easier for all of us because, of course, we can use web-based things or mobile applications and something like this. And depending on the patient needs, I usually have a sort of list with all these links and everything, which is possible to use with every patient, depends on their things and problems which just need to be discussed for today. It's a first thing. Another thing is I really believe that there are three main direction in patient-centered care. First of all, it's a self-management of the patient. So we need to add some sort of education every time when we meet the patient. The second direction is peer support, because without it, for now, it's almost impossible for patients to be involved in all these activities about diabetes, at least in my country. So the next step is to discuss all these groups, or maybe chats, or I don't know, WhatsApp discussions and messenger usage, something like patient organization around this city or district of the patient, because I have a lot of consultations from patients all over my country. And only the third part is real medical things. So I think that going through all these parts, like first education and links to the web societies of patients, like the second part, and the third part discussion of all numbers and observation, examinations, and everything like this. And I think
Sorry, is it a problem to you, Evgenya, that we find very often through social media not only the good information and the good support, but also the misinformation? I mean, we've seen a huge issue of that with vaccines. And is it an issue also in diabetes?
Yeah, but that's why we always discussing with the patients what types of social media is possible to use. Of course, it's possible just to suffer for everything and just trying to write all information on different groups and everywhere on internet. But when I'm talking about listing, like links and everything, we discuss in all these groups, which mostly approved by healthcare professionals, which some sort of control of information, because it's only the way just to be sure that patient will read all everything like approved information from us. So, of course, there are a lot of things like pros and cons and everything and social media too. But for me, it's mostly pros. Advantages are huge, for, at least in my country. Maybe somewhere like in the United States, which are huge help of American Diabetes Association, on Diabetes UK, in the United Kingdom. But in Russia, we still need to use all this social media and even these regional social media groups, because it's very helpful for patients, like to find all information about their disease.
I think you'll find that at the US and indeed every other country in the world, misinformation is as easy to find as it is anywhere else. Florian, misinformation. So it's very important that you, right at the beginning of the patient's journey with diabetes, that you establish the right sites to go to, the kind of information, establish what the patient really wants, all of those kind of things. So is that first visit a really crucial visit?
Well, it's very important. It's very important. I try to extend the consultation at the first visit with the patient, especially for the new cases of diabetes, because there you create the basis for the future consultation and the follow-up of the patient. So you need to focus more in the person than in the disease. And especially, it is very, let's say, difficult, but it comes with experience to find what is more important for the patient and for his health at the same moment. So you can find a balance between both sides of that. And this comes, I think, a little bit like intuitive sensation from our part as healthcare provider. But as you have mentioned, misinformation, it's very important, and we need to work with it. Here, for example, in Albania, we are using the social media as a group discussion, because with the COVID situation, it is very difficult to organize the education, the group education, which is more important for people with diabetes. So we are trying to use Zoom meetings, for example, to have a group meeting for people with diabetes to discuss between them. But it's true that it's a little bit difficult. And in some cases, this kind of misinformation are more creating problems than creating solutions for people with diabetes. We have a lot of problems, actually, for example, with the vaccination for people with diabetes or for COVID-19. There are a lot, especially of young people with diabetes, refusing to have the vaccination. and we are working hard on it to fix and to help the institutions to increase the number of people, because as we all know, people with diabetes is one of the most risky group for COVID complications due to their first disease, which is diabetes.
We're coming towards the end of our time together, but what I wanted to ask you both was your practical tips. I mean, you are clearly doing this thing absolutely right. And I wanted to have some quick fire tips from each of you that anybody listening could go and apply in their own practice. So, Evgenya, we've already had from you that very helpful idea of a questionnaire. What else would be your tips for really improving patient-centered care?
Okay, 5 tips. First, use the time before consultation. Second one, remember about quality of life, because patients usually can feel themselves like unsafe in medical organization or everywhere around healthcare professionals. So just remember about a person with their fears and suggestions around them. So quality of life, the second one. So just remember that you as a healthcare professional cannot use paternalistic approach, and you can just thinking about trust between you and patient, and you need to just try to be as close to the patient as possible, because it's the only way to be efficient in diabetes care. First is something around these 3 important things, like self-management, education, and about peer support, and about your as a healthcare professional only on this third phase, not on the first or second, because it's just we are only a part of patient's life. And the last one is trying to involve a patient's family or friends or close people in diabetes care. You can at least have people who will help you during their life with patient with diabetes.
That's very helpful. Florian, what are your tips?
Well, listening Evgenia, I have to agree that some of the tips are almost the same. I would say that the first tip is to ask the patient what is more important for him, because we need to evaluate our patient and to see what is the most important for him, because this is working more easily with him too.
Florian, sorry to stop you a second. For example, you may have some patients who have a great fear of, hypoglycemia during the night, for instance, or they may have, and it may be quite difficult to get it out of them what it is that they're really frightened of.
So in this case, we need to find the balance, because what is more important for the patient and what do we think? So we need to evaluate and to find a compromise between both our goals or objectives. For that, I think that this is the first one. And the second is to keep notes, so we can find a solution between both of us. And the third one, I think, is that we need to focus just in 1 or 2 problems related to each of our patients, because otherwise we will be lost and the patient will be lost. Another issue or tip is that we use a lot the family. So almost each of our people with diabetes is coming in consultation with his wife or his husband. Normally it's the husband coming with the wife, not the vice versa. But we are using the family to help us to create a healthier lifestyle. And the last tip that I would say is keep simple. So we don't need to give too much objectives or too much counsels in the first consultation, but just 1 or 2. And every one of these tips is related to one of ours. So if we keep notes of what we have said or what we have decided, in the next consultation, it will be more easy for us to remember and to see if things are done. And for the patient, it will be more important, because he could see with himself that what he has said is really in our mind and keep in the process of the education and
Florian,
the follow-up of the
Toti,
patient.
Evgenya, Patrakeeva, it's been fantastic. Those are such good tips from you. I'm afraid we have to go now.
Such a short
Thank you
period
so
of time
much
to speak about education.
Thank you so much to both of you. Well, some absolutely terrific tips there. And there's more to come.